Good morning, students. In today's LCD class, we are going to study the interior of the skull. Okay. Now, from the complete skull, we have separated the vault of the skull. And after separating the vault of the skull, what you see on the interior side, this internal portion is called as the interior of the skull. So, in the interior of the skull, it is divided into three parts. This anterior portion is the anterior cranial fossa. This is the middle cranial fossa, and this posterior deep part is called as the posterior cranial fossa. Features that you see in the vault of the skull, you will study in a separate video. Now, in today's class, first we are going to study about the anterior cranial fossa. So this is the anterior cranial fossa. This anterior cranial fossa, it lodges the frontal lobes of the brain. Okay, so the frontal lobes of the brain are lodged over here. Now, let us study its boundaries. So anteriorly, you have the orbital plate of the frontal bone. This is a part of the frontal bone. Now you have already seen this is the frontal bone. This frontal bone, it forms the roof of orbit as well. This is the orbit. This is the floor, whereas this is the roof. So you can see that the frontal bone, it is forming the roof of the orbit as well. So this portion of the frontal bone is called as the orbital plate of the frontal bone. Here in the anterior part, you can see some cavities between the outer table and the inner table. You can see some cavities. These are the frontal air sinuses. Frontal air sinuses. In the midline part of the frontal bone, here you are seeing a projection. This projecting part, it is called as the frontal crest of the frontal bone. So this is the frontal crest of the frontal bone. These are the orbital plates of the frontal bone, which are forming the roof of the orbit. And posteriorly, here this bone, this wing shaped bone, what you are seeing is the lesser wing of the sphenoid. Okay, so this margin, this is the posterior free margin of the lesser wing of the sphenoid posteriorly. The lesser wing of the sphenoid posteriorly has got a projecting part in the midline. Here you can see this. These are called as the anterior clinoid process. This is the anterior clinoid process. In the midline, you are seeing a shallow groove. This shallow groove, it is called as a sulcus chiasmaticus. So, the sulcus chiasmaticus has got an anterior border and posterior border. So, this is the anterior border of the sulcus chiasmaticus. Now, remember, this sulcus chiasmaticus does not lodge the frontal, does not lodge the optic chiasma. Okay. Now, in the midline, we have already seen the frontal crest of the frontal bone. Here you are seeing another quadrilateral piece of bone, which has got many small foramina in it. You can see nicely. Okay. This is called as a cribriform plate of the ethmoid. This is the cribriform plate of the ethmoid. So the cribriform plate of the ethmoid anteriorly articulates with the frontal bone. Between this cribriform plate of the ethmoid and this frontal crest, here you can see a small foramina. This is called as a foramen cecum. This foramen cecum is usually blind foramen, but sometimes it is patent. And when it is patent, it transmits a vein from the nasal cavity to the superior sagittal sinus. Now, in the midline, again, you are seeing this projecting part. This projecting part is called as crista galli. This crista galli along with the frontal crest, these both they give attachment to the falx cerebri. Falx cerebri, it is one of the dural folds. Now let us discuss in detail about this cribriform plate of the ethmoid. As you can see, it is quadrangular shaped bone and it has got many sieves, or it's sieve-like, it has got many foramina. These foramina, they transmit the olfactory nerves from the nasal cavity to the olfactory bulb. Now you can see over here, this is the nasal cavity. So this cribriform plate of the ethmoid, it is forming the roof of the nasal cavity. So from the roof of the nasal cavity, the olfactory nerves, they pass from these foramina to the olfactory bulbs which are present in the orbital surface of the frontal lobe. This olfactory bulbs are lodged in this region. Now posteriorly, you can see where these cribriform plate of the ethmoid, they articulate with the jugum sphenoidale. Here you can see two foramina on the posterolateral side. You can see these two small foramina on the posterolateral side. These are the posterior ethmoidal canals. These posterior ethmoidal canals, they transmit the posterior ethmoidal nerves and the vessels. On the side where the cribriform plate of the ethmoid articulate with the orbital plate of the frontal bone, you have again two small foramina on either side. These are the anterior ethmoidal canals which transmit the anterior ethmoidal nerves and the vessels. These are the orbital plates of the frontal bone we have already discussed, and over here in this region lodges the frontal lobe of the cerebral hemisphere. Now this portion, this is the jugum sphenoidale or the body of the sphenoid. This jugum sphenoidale, it forms the roof of the sphenoidal air sinus. Now posteriorly, we have already seen this is the posterior free border of the lesser wing of the sphenoid. This free margin of the lesser wing of the sphenoid, it projects into the lateral sulcus of the cerebrum. Now the cerebral surface has got many sulci and gyri. Out of that, one important is the lateral sulcus. So this free margin, it projects in the lateral sulcus of the cerebral hemisphere. This projecting part in the midline, this is the anterior clinoid process. This anterior clinoid process, it gives attachment to the free margin of the tentorium cerebelli. Gives attachment to the free margin of the tentorium cerebelli. Okay. Now, you can clearly see over here that this free margin of the posterior of the lesser wing of the sphenoid, it overhangs the middle cranial fossa, and underneath this free margin of the lesser wing of the sphenoid, you will see this oblique shaped groove. If I put my probe, this oblique shaped groove, it opens in this region. Here this is the orbit, and here in the orbit you can see, here you are able to see this oblique shaped groove or fossa. This is called as superior orbital fissure. So underneath this lesser wing of the sphenoid, here you are seeing this oblique shaped fissure. This is the superior orbital fissure. Okay. Now the structures passing to the superior orbital fissure, you are going to study in detail when you study the norma frontalis and the details of the orbit. Now This lesser wing of the sphenoid, when it articulates with the jugum sphenoidale, you can see a foramen formed over here. I put my probe into this foramen. Just on either side of the sulcus chiasmaticus. This is the optic canal. Here you can see the probe emerging to the optic canal in the orbit. This is the optic canal on either side of the sulcus chiasmaticus. So optic nerve and the ophthalmic artery, they pass through this optic canal. Now remember students, whatever foramina we are showing you, these are very important. In exam, when you are given the skull, you have to identify these foramina as well as tell the structures passing to these foramina. So try to identify these foramina very carefully. So on either side, here you are seeing this is the optic canal, and underneath the lesser wing of the sphenoid, this oblique fissure, this is the superior orbital fissure. Okay, so we have studied almost all the features of the anterior cranial fossa. In the next video, we will study about the middle cranial fossa and its features.